Based on the number of cases on the Nebraska Department of Health and Human Services case map, Adams County had as many COVID-19 cases as Lancaster County, and Hall County was approaching the total in Douglas County. The Lincoln and Omaha areas have about 10 times the population of Adams and Hall County, respectively. Does a case per resident ratio of 10 times higher in parts of the Tri-Cities tell you that something isn't working correctly in the plan that's in place to slow this in Nebraska? And actually, I would say the plan is working because we have not overwhelmed the healthcare system in Grand Island. That over a week ago, we reached out to St. Francis, and Dr. Antone was on the conversation directly with them with regard to what we were seeing coming with regards to the percent positivity ratios that we had in Grand Island and what that could mean down the road, and just keeping an eye on how many ICU beds they had available, how many ventilators they had available. Obviously, part of our plan was always to be able to move patients around, to take a statewide approach to our healthcare system so that we could leverage where we had capacity in one part of the state if we were coming up against our capacity in another part of the state. And that's what we've done in Grand Island. So St. Francis, for example, has leveraged the ability to be able to move some of those patients. I think a week and a half ago, they were having about it was actually a week ago Monday, they had 3 patients on ventilators in St. Francis, so they've got 13. So we have seen an increase in the number of people who need that facility, but we've been able to manage those resources in a way to make sure that everybody who needs that is able to get access to it. And folks, this is the real key. This is what we're focused on. We're looking at hospital utilization, ICU utilization, ventilators, things like that, to make sure that everybody who needs that help will be able to get that help. That's what we're focused on, how we manage this. So the plan actually is working the way that we planned it.